Know how long they get before the doctor interrupts? 22 seconds. A patient waits 45 minutes, 22 seconds of uninterrupted attention. 60% of all complaints are caused by communication failure. 1 in 3 patients never returns after a poor first experience. When a patient begins speaking, do you know how long they get before the doctor interrupts? 22 seconds. That is not my opinion, that is what research shows. In a landmark study published in the Annals of Internal Medicine, researchers found that doctors interrupted patients after just 18 seconds. 18 seconds in one study, 23 seconds in another, the average across the research 22 seconds. Watch this short interaction.
So, tell me, what's going on with you?
Well, there are a few things that were on my mind. I've been having a problem with my back, and then I
Let's
also...
talk about that. What's going on with your back?
Well, I've been having a pain in the lower part of my back the past few
Dull?
weeks, and I...
Sharp?
Sort of a dull pain, but it
Does
doesn't...
it radiate out? Does it go through your back or down into your legs?
Well, I feel it in my lower back on both sides, and sometimes in the back of my right leg. Sometimes it can last
Does anything
for...
make it feel better? Make it feel worse?
Suddenly, your visit is almost over, and you may not have even mentioned your main concern.
Link is in the description below. Think about that. A patient waits 45 minutes in the waiting room and for 22 seconds of uninterrupted attention. And when the story is incomplete, the diagnosis is incomplete too. The plan is incomplete. The patient leaves confused and they do not come back. And the consequences of this are far bigger than we imagine. Studies show that up to 60% of the patients leave the consultation with their main concern unaddressed. Half of them walk out without fully understanding their diagnosis, and 40 to 80% of everything that the doctor said is forgotten within minutes. This isn't a clinical problem, this is a communication problem. In the NHS, 60% of all complaints are caused by communication failure, not medical errors. In US, Harvard's malpractice database shows that 70% of lawsuits involve communication breakdowns. And here is the part hospital owners should pay attention to. 1 in 3 patients never returns after a poor first experience. Not because the doctor was bad, not because the treatment was wrong, but because the patient did not feel heard. But what if the consultation did not start at 0? What if the doctor already knew the patient's story before the patient walked in? Subscribe, because in my next video I will show you how AI makes that possible. Why? It changes everything.